Hi there. My name is Dr. Pete Lallier, Clinic Director at Hopkins Health and Wellness Center. I'm a chiropractor that's been practicing for 30 years in Hopkins, Minnesota, and I'm here today to talk to you about Scrambler Therapy. Before I get started, I want to tell you a little bit about our practice and kind of the background and how we got involved with this innovative new therapy called Scrambler Therapy. As I said earlier, I've been practicing for 30 years and I work with a team, a very dynamic team of medical providers, including a general practice medical physician, an orthopedist, a PA, and also a nurse practitioner. Also, we have a team of physical therapists and a team of chiropractors that work collaboratively together to provide innovative treatments for patients non-surgically. So I want to get into Scrambler Therapy and describe what it actually is and give you guys some background. Okay, so Scrambler Therapy is a pain management approach that uses a machine to block the transmission of pain signals by providing non-pain information to nerve fibers that have been receiving pain messages. So basically it kind of reprograms your brain to accept the pain signals as no pain. The first study on Scrambler Therapy was published in 2003 by a team of researchers led by Dr. Giuseppe, a professor in Delta Research and Development at the University of Rome, Tor Vergata in Italy. He and colleagues reported that Scrambler Therapy was effective at reducing pain symptoms in patients with severe drug-resistant pain from terminal cancer. The Scrambler Therapy device has since received FDA clearance in the United States for use in patients experiencing 1. Pain from cancer and chemotherapy. 2. Pain as a result of chronic disease such as diabetes and multiple sclerosis. 3. Chronic back and neck pain. 4. Pain from failed back surgery syndrome. And 5. Phantom limb pain. Okay, now this gets a little tricky. How does it actually work? Scrambler Therapy is an electrocutaneous treatment. It provides normal self, non-pain electrical information via nerves that have been transmitting chronic pain information to your brain. Through a process termed plasticity, non-pain information is able to retrain the brain so it does not ascribe pain to the chronic pain area. So basically, like I was saying a little bit earlier, it teaches your brain to no longer accept the pain signals as pain. Instead, your brain interprets it as no pain. So Scrambler Therapy consists of a machine which looks somewhat like an electrocardiogram machine. Leads are placed on a patient around the areas of chronic pain. Scrambler electrical signals are then sent to the brain that perceives them as normal non-pain signals. Essentially, the brain is retrained to think that there's really not pain in the area that's being treated. At first, the pain symptoms go into remission for a short period of time. And then after that, approximately 10 sessions, the patient will experience continuous pain remission. And that pain remission will last from 3 to 9 months. And then the therapy can be done again just to do a booster treatment to make it go back into remission again. I'm going to describe just briefly kind of the Scrambler Therapy treatment program, how it works. What we do is we start by doing a detailed history and review of a patient's records. Then we have a neuropathy questionnaire that we have every patient complete. We review that, and then we review other treatments and contraindications to Scrambler Therapy. Some medications that people are taking are contraindications, and we have to either not do the Scrambler Therapy or else we have to wean them off the medications. Then we do 10 35-minute doses of Scrambler Therapy. We do that on a daily basis. We have to do the first 5 days in a row, and then we can have a 2-day break, but it's really important that we do it daily to make the symptoms go into remission as quickly as possible. We also provide the patient with 30 days of supportive nutritional supplements. The idea is we want to upregulate your body's ability to decrease inflammation and also help the nerves be as healthy as possible. So, what to expect with the treatments when a person actually goes into Scrambler Therapy? I've got a great graphic I'm going to share with you in a moment that kind of shows what occurs. Um, while a person is in a comfortable seated position, the area of pain or neuropathy is first defined, and we put a set of leads around that area as close to that pain area as possible, but not actually right on the pain area. The electrodes are then turned on with a gradual increase in intensity to the point where the patient is able to feel sensations, but it's short of pain. When successful, the patient reports that the buzzing sensation that they're feeling has replaced the area of pain or neuropathy. So they'll feel buzzing where the pads are, but the neuropathic symptoms that they have beyond that will start to let up or go away completely. That's when we really know that we've got the electrodes placed in the right area or on the right dermatome. At times, the electrodes needs to be moved to obtain that sort of success, and so we have to be dynamic, and that's where our knowledge of neurology, the dermatome patterns, and experience with working with many other patients with similar neuropathic pain really helps us out. Then the Scrambler Therapy machine, once we've got things set properly, stays on for 30 minutes continuously. And then the electricity at that point is turned off, and the patient calmly reports that the pain and tingling is markedly improved. After one treatment, the benefit is often relatively short. Remember, I said it will last maybe an hour to 3 hours. It's a short period of time. Within repetitive days of treatment, which is standardly about 10 treatments, the symptoms, the period of remission starts to broaden, and the person will get to the point where they're like, yeah, until the next day it didn't recur at all. And then finally, the patients will have a time period where they have remission for a continuous period of time that lasts for a couple of days. Then we know that we've got it in remission completely. And like I said earlier, that time of remission usually lasts from 3 to 9 months. And then it will start to kind of creep back a little bit. So I'm going to show a graphic now that kind of shows kind of what happens. And there's kind of, we call it the 3 R's of Scrambler Therapy remission. And in the relief phase, we have a rapid relief of the symptoms, but it lasts for a short duration. That starts to span out. And then in the reset phase, the person has progressive relief with increased duration and unmasking. That is really like the key time the person is like really starts to feel like, oh my goodness, this is not only feeling better and better, and I'm getting more and more remission, or the symptoms are much less or completely eliminated, but wow, now it's starting to stay for a longer period of time. And it never rebounds back to the level of symptoms they were having before. And then, of course, what everybody wants is we want the remission phase. That means that they've had maintained relief for 2 days, and they feel like they can walk and move better. They got a better sense with their feet, or else their hands. They feel like they're more coordinated, and they just basically are like, wow, it's gone, and I'm functioning better as a result of that. So it really is amazing. Patients, when they receive the therapy, they're always like, how in the world can that be working? Because my foot's not burning anymore. And these are people that have had years of neuropathic pain, and all of a sudden they have relief. It's been a really amazing therapy for us to be able to provide to patients. It's very life-changing for a lot of people. Gets them off medications, and gets them to a different level with being able to control their symptoms. The studies done at Mayo Medical Centers, basically they say that this produces the best outcome they've ever seen for any neuropathy treatment that they've ever tried to perform with people. We would love to help you or talk to you about how Scrambler Therapy could potentially help you. If you have any questions, feel free to contact me personally. You can reach me at drpete@hopkinswellness.com, or you can always call the clinic and make an appointment for a Scrambler Therapy consultation. The number of our clinic is 952-933-5085, or you can request an appointment online at hopkinswellness.com. And specifically when you make the appointment request, in the other information or memo area, say Scrambler Therapy Consultation. It was nice talking to you today about Scrambler Therapy. Here's Jeff. He's going to tell his story, and I look forward to helping you with controlling your neuropathy symptoms in the future.
My read on this is it's like a miracle for anyone that's had pain. I never thought there was anything out there that could provide pain relief like this. You name it, I've tried. When you're in pain, you try everything and you hope you find something that really works. And this machine really works.